All right. So thank you for introducing us and for inviting us, because I think both Aimee and I feel pretty passionately about the topic of language and language disorders because of the implications that they have for all of us in everyday life. Language, as we're going to talk about in the next hour or so, is the way we navigate every day, all day, and all of the interactions that we have with other people. And so I think its importance is so significant that sometimes it just seems like it's a given, and it's not a given, and it's not a given for a lot of people. And when people have difficulty with language, they can have some really profound consequences. So hopefully we can do some credit to the topic, and I'm going to talk a little bit about language disorders in terms of spoken language, and Aimee is going to talk in the second half about language disorders and how that implicates in literacy skills and learning at school. So just in terms of getting started, Aimee and I do not have any conflicts of interest that we have to disclose. We have no financial gain. We are here because we really like this topic. And I think our objectives are a great example of how fun language can be, because the objectives that you saw on the flyer are not the words that I picked as my objectives, but there are many ways that we can express things in language. So although I was going to describe the features of developmental language disorders, today we're going to actually delineate them, because there's different words that mean different things and different words that mean the same things. And so delineate seemed like a fun word, obviously, and Dr. Nicholson picked that one instead. We're going to talk about the implications of developmental language disorders on the functional tasks of daily living, like I said earlier. And then Aimee is going to perhaps talk at length, I guess it depends how much time is left, about the relationship between language and literacy. So that little roadmap of objectives hopefully will help you to feel oriented as we go through the next hour or so. In terms of our first objective, I really think that to be able to talk about developmental language disorders and the implications of developmental language disorders, we have to talk first about what is typical language, and then how do we know if language is disordered? So what are the clinical signs? What are the terms and definitions that we would use to identify a language disorder, so that then we would know everybody's talking about the same thing? So what is language? And it sounds like a silly place to start, but I think, like I said earlier, before we can talk about what is a disorder of language, we have to talk about language first. But language is something that comes really naturally to most of us, and probably especially to those of us who are at today's presentation. So we have all learned to speak language long, long ago. It probably happened for most of us without a great deal of effort. It's something that we use as a tool without really even thinking about it. There's lots of different languages in the world. We kind of just take that for granted. There's lots of different modalities of language, and most of us have learned to navigate lots of different modalities. We can speak language, we think in language, and we'll talk more about that later on. We can use written language to share information from person to person, from generation to generation, to transfer information from higher levels of administration down to lower levels. So it is a tool that we use so commonly that it's something that we assume has always been. But language actually is a skill. And so I think to be able to talk about language disorders, we have to really recognize that language is something that we have as a tool, as a skill, and that it doesn't come that easily and that naturally for everyone. So in thinking about language, I think it's really important, though, to clarify terms. What does it mean when we talk about language? Because again, language is a word we use all the time. What is language? So we start by talking about communication. So communication is really an umbrella term, and communication refers to the way that we would transmit a message from one person to another person. So the sending and receiving of information from one person to another. And that can happen a lot of different ways, and language is one of those ways. So communication, again, is an overarching term. We can share information using verbal communication, so language, and we'll talk about that. We can also share lots of information non-verbally. If I give you a look or a tone of voice that influences what you think or how you act or your attitudes, then I am sharing a message. Language is one of the ways that we communicate, and language is a conventional system. So it is a system that we as a society have decided on that includes words and rule-governed rules of grammar that a particular community decided on as a system that we will share information with other people. So we have picked, in English, we picked the sound sequence apple to refer to this little piece of fruit. But there is nothing inherently apple about that piece of fruit, because in French they call it a pomme, and in Hungarian they call it an alma. I'm sure I'm not saying that correctly. In Portuguese they call it a maca. So we as a society, an English-speaking society, call it an apple. That's a conventional system we've decided on. And to be able to crack the code of language, you have to be able to know what are the conventional symbols for the objects and actions and experiences of our world. And then you also have to be able to crack the code of grammar. So we put those words together in a rule-governed way. There's a certain rule about sequencing. There's a certain rule about what types of words you have to have when you create a sentence to share information with others. And again, that's very conventional. That's very decided upon. So in English, we use pronouns as a separate word at the beginning of a sentence. So it's almost Valentine's Day. So I went with love, I love, you love. In Latin, they don't use words at the beginning of a sentence to represent the person or the pronoun. They put a suffix on the end of a word. So amo for I love and amas for you love. And the sounds at the end of the word are what tell you about the subject of that sentence. So language is very rule governed, very conventional. And again, I think for most of us, because it just sort of develops and happens for us, we take that for granted. There's also a lot of different components of language that it's easy to take for granted. So like I said a couple times already, language happens effortlessly for most of us. But what I think sometimes we forget to realize is that there's different layers of language. So when we're looking at the system of language, we can look at the form of language. So the form of language would be phonology, the sounds that make up that language. There are different sounds in the English language than there are in an Arabic language. And so each language is unique that way. Morphology being the small units of sound that convey meaning. So in English, if I put an S at the end of a word, it means that there's more than one of those things. Or if I put an ED at the end of the word, it means that something happened in the past and refers to a sense of time. Syntax is the rules of grammar, like I talked about a minute ago. What are the orders in which I have to put words to make it make sense in a particular language, in English, in Latin? Then to be able to manage language, you also have to talk about the meaning of language. And so this comes back to our objectives, right? Do I want to describe or do I want to delineate? Words can mean, we can use the same word to mean more than one thing, or we can use different words to mean the same thing. And you have to understand the meaning of words to be able to convey meaning. Then there's another layer. Then we have to be able to put those words together in the social context of language. How do I know what is the right way to say something to different people? The way I might phrase a sentence or a message to my husband or my children or someone who's very familiar to me might be very different than the way I would phrase a message to somebody who is a stranger or somebody higher than me in a job hierarchy. And so there's ways that we have to use language that are also very rule governed and really influence the success or failure for language and communicating, sending messages to one another. Also, when we think about language, I think it's important to think about there's two sides of language. So one is the expressive side of language, which is the speaker that produces and sends a message to another person. The second side of that is the receptive. You also have to be able to receive and understand that message. And expressive and receptive are two different sides of language that, again, may not happen in sync for speakers who have difficulties with language. And so the components of language, when you start breaking it down and thinking about it, make you realize, wow, there's a lot to this. There's a lot to this system. And quite frankly, it's surprising that it happens so easily and effortlessly for the number of people for whom it does. When we look at language development and typical language development, there's a really predictable pattern of what we would expect. And so this is just a milestone chart that was generated from a Google search. I think you can find early language milestone charts pretty much anywhere, but it lets us know that this system of language, the form, the content, the use, it happens in a really predictable way for most people. And so we can monitor in children's development whether language is emerging the way we would expect it to to. And really what that lets us do is that it lets us flag, hopefully as quickly and early as possible, if language isn't developing easily and effortlessly, so that we can start looking at what's going wrong and attempt to provide some intervention. In the current version of the DSM, they refer to the not typical development of language as a language disorder with the area of developmental. In the field of speech language pathology, there's a real push. The term for language disorder has changed over the years. We used to call it a specific language impairment. And, you know, in recent years, there's been a shift to calling it a developmental language disorder, DLD. And so I'll use that term to refer to it as we talk for the next little while. In the DSM, they come close to calling it a DLD. They call it a language, they call it an LDD. But I think what it is defined as is that persistent difficulties in acquiring and using language across modalities. So the thinking, talking, writing, that include any or all of these characteristics. So reduced vocabulary, word knowledge, sentence structure, figuring out how to create those sentences with the rules of grammar, impairments in discourse, being able to use language for higher level purposes like conversations, explanations, storytelling. And that those difficulties that someone with a language disorder would experience would be what we would call substantially and quantifiably below what would be expected for their age range. And it really results then in some functional impairments for them in using language to navigate all of the activities of daily life. And we'll talk in a bit about what those activities are. I think the interesting piece of this particular point in the DSM-5 criteria, though, is substantially and quantifiably below expected for age. And so we'll talk in a few minutes too about what does that mean? How do we define that? In terms of language disorder, though, we would obviously expect to see the onset in the developmental period, and we would rule out that the language difficulties are resulting from any other cause, something like a hearing impairment and intellectual disability. We would expect language to also be compromised if someone has a hearing impairment or an intellectual disability. So a developmental language disorder then would not be attributable to another cause. And we make that diagnosis, not so much we as the speech language pathologists, but as the diagnosticians, according to the collection of lots of different types of information. And so we would gather information from a parent history, looking at those developmental milestones and were they met, were they not met, you know, where were problems identified, clinical observation. And I'm going to try to show you a video in a minute of what I mean from that. And we want to gather information from multiple contexts because language is used differently by speakers in different places. And again, scores from standardized language tests, and we'll talk about that in a minute as well. So I'm going to try to show you a little video. Hopefully it'll run. Maybe Dr. Nicholson, you can flag for me if it doesn't run, because otherwise it's 2 minutes of dead time for folks. But I think, you know, this is a nice little example of what does a language disorder sometimes look like. And this is just a little gal taken from the internet.
Hey.
Hey.
How you doing today?
Good.
What's your name?
Aubrey.
What grade are you in?
Third.
How old are you?
8.
So, what book did you just read?
Author's Lost Tooth.
Was it a good book?
Yes.
You want to tell me about that book?
Yes. Well, you know, most of the things like that, author's first tooth. He wanted to come out, and then it's the star violet. It's scared of the dark. She's scared of the dark, and she and then she aimed the doorknob right on the doorknob. Babysitter came, and it came out, and then it was a good book.
You enjoyed the book?
Yep.
Okay.
Are we done?
Okay. So hopefully everybody could watch that video, and I promise you it is only just over 2 minutes, but I don't know about you, it feels like to me it's a lot longer than that. And I think it feels like it's a lot longer than that because you can see how effortful it is for this little Aubrey to be able to tell her story about the book that she read, Arthur's Lost Tooth. And so I think she's a great little example of a language disorder because clearly Aubrey talks. Clearly Aubrey's speech is fine. It's easy to understand the words that she's saying. She is certainly trying to communicate. She is trying to share information from one person to another. But that vehicle of communication, her language skills, really is making that very functionally difficult for her. So in terms of assessment for language disorder, like we talked about from that last slide, I think clinical observation, there's a lot we can gather from watching that little video of Aubrey. Now, if we had more time, I'd make you figure out what you'd seen there, but I'm going to tell you the answers today. So if we're looking at Aubrey and kind of an example of a language disorder, Aubrey's answers are pretty short. Her sentences don't include a lot of words. They don't include a lot of elaboration. She often pauses before she says something. And I think for Aubrey, she's trying to find the words that she needs to share her thoughts and ideas. She's got lots of placeholders, well, you know, and again, I think she's buying herself time to organize and formulate language. She restarts and revises what she's trying to say to be able to make that message better. There's lots of incomplete sentences. She's using a lot of generic words. So she uses the word she at one point in time, and you're not quite sure what she's referring to there. She's got grammatical errors, so it's came out. And I think at the end of the day, if I were to say to you, okay, tell me what Arthur's Lost Tooth is about, you wouldn't be able to tell me. And so really, I think at the end of the day, the listener can't understand the message of poor little Aubrey with her language disorder. So there's lots of clinical observations that certainly for us would be red flags and areas of concern in looking at a developmental language disorder for Aubrey. I think the other piece of the DSM criteria that we talked about was sort of that quantifiably and substantially below what we would expect for the age. And so from standardized testing, we can also complete formal assessment. The trick for language disorder is that we don't really have a good benchmark of what is the cutoff. So in school, they taught us that we would call a language disorder kind of a score between 1.5 to 2 standard deviations below the mean. Even that window doesn't really give us a clear identifiable cutoff for what would we say is a language disorder and what is not. And I think there's good reason for not being so hard and fast about that. I know in the world of psychology, we use the score of 70, but we've often had debates, you know, what's the difference between 71 and 69? And I think the speech language pathology field has tried to not get caught widening that specific number. But I think the question really is, how weak is it if it's a problem? Is it weak if you have language skills at the 2nd percentile? What if you had language skills at the 5th percentile? I still wouldn't be all that thrilled if I had language skills at the 5th percentile. What if I had skills at the 10th percentile? Life is still going to be hard because, again, life happens in language. So we can come back and talk about sort of that cutoff criteria and what not having one means later on in the discussion part of our talk today. In terms of the standardized components of language assessment, there's lots of different tools that we have as speech language pathologists to be able to look at the different areas of language. We can look at vocabulary, we can look at grammar with all of these tests that are up there. And if you want to know more about them, we can talk more about them later. But those are the building blocks of language, the words and the grammar and the rules of grammar. We can have kids that have difficulties at that level, or we can have kids that are not too bad at that level, but have real difficulty at what I would call a higher level. So using language, using those words and the grammatical structure to be able to convey information in more abstract ways. We can assess for that, but I think those kids can be really tricky because they can look good, they can sound good, and their difficulties are happening at more of a sort of cognitive level. And then we also have language tests for social communication. Personally, I don't like standardized language tests for social communication. I think social communication is really a very qualitative skill, and I'm not sure that you can capture that in a standardized assessment. But again, we can talk more about that later. So I'm just going to buzz through some early risk factors and some talking points, and then I want to turn the floor over to Aimee so she can talk about literacy, and we can come back to anything later on that we want to. I think in terms of looking at and monitoring for language issues, though, some of the things just to be aware of, because again, we take language for granted, is that we know that language develops according to that developmental milestone chart that I showed you earlier. And we know that there's kind of a range of typical development. I think in the past, we've often thought that boys develop language slower, girls maybe faster. And I think there's some truth to that. But what the literature shows really is that all children develop language within a certain range. Maybe the girls are close to the beginning of the range and the boys close to the end of the range. But I think what we don't want to say is, well, he's a boy, he's likely to talk later. We know that, if there's a delay that's longer than that, we need to figure out what's going on. We know there's a greater risk in boys than in girls. We know there's a greater risk in twins, especially boy twins. But what we know is that kids, only about 40 to 50% of kids who are late to talk catch up on their own. And the tricky thing is we don't know which of those kids are going to catch up on their own and which kids aren't. So again, if you're seeing red flags of concern, we want to get that looked at sooner rather than later. And we know that bilingual kids who are speaking more than one language, will show similar patterns of delay in both languages. So again, that's an area of concern. We wouldn't necessarily say, well, he's behind because he's learning 2 languages. We would see that there are difficulties in both languages. I just want to touch on, in the last couple minutes that we have, sort of the implications of language. And I don't think we can do, or language disorders, I don't think we can do it justice here. So I will put these talking points out there for you. You can reflect upon them. You can read upon them with the references that are there if you want, and we can talk about them more. But I've said a couple times already, life happens in language. And I think the reality is the way we navigate all of the experiences through it every day is through language, whether that is external language that we're using to communicate with other people, or whether that's internal language that we're using to think and problem solve for ourselves. And I think about kids who have developmental language disorders as, what would it be like for me if I was in another country for which I didn't speak the language? But I don't even know that that's a fair comparison, because if I found myself in Vietnam and I didn't speak the language, I would still have English to think about, to think in, and to try to problem solve and navigate. And I think the difficulty is for kids who have developmental language disorders, they don't have that first language to fall back on. It is their first language that's a problem. And so all of the everyday tasks, following instructions, learning how to do things, if you can't figure out what people are trying to tell you, how anxiety provoking would that be? You must always feel like you're in a state of confusion and disorientation. And so basic learning for all of the things that your mom, your dad, your teacher, your grandma, your babysitter try to tell you and teach you, all of the sources from which you would gather information, leisure activities like watching television, listening to the radio, and then thinking and problem solving throughout all of the choices and decisions that you have to make every day. Learning, I'm going to leave that one to Aimee in the next couple minutes. And then socially, again, we interact with other people socially. So we play with other kids with language, and we use toys as symbols. Well, we talked earlier about words are symbols. So if we can't crack the code of language, we might not be able to play very successfully either. Interacting, navigating with peers, having conversations, negotiating, all of those tasks that we need as we navigate day-to-day activities, academic activities, interactions with people we know well, interactions with people we don't know well, depend on language. And if we don't have language, then we're really going to have a lot of difficulty. In terms of just things I want you to reflect on, we know that language disorders are actually pretty common. Up to 7% of kids have language disorders. We know that they're highly heritable. They're more likely to run in families. We know that there's a prevalence in terms of who is more likely to have a language disorder based on sort of race and genetics and all of the pieces that go together for that. In the past, the DSM for text revision used to separate language disorders in terms of receptive and expressive language disorders. The current version of DSM doesn't do that now, it just sort of lumps them all together. But I think it's important to know what are the differences between receptive skills and expressive skills, because we know that kids who have poor receptive skills actually have a poor prognosis over time. And so again, we want to know that because we want to be providing intervention accordingly. We also know that language development changes over childhood, and you can think back to that developmental milestone chart that I showed you earlier. So we might not see somebody with a higher level language disorder obviously having difficulties when they're in their preschool years. Those language difficulties might not emerge until later. And so again, we have to kind of keep our eye on things throughout the developmental period. We can't rule it out at any point in time. We know that skills like vocabulary are very critical to school success and to later reading and writing abilities. And I think lastly, particularly in terms of the kids that we see at CPRI, we know the significance of language and communication disorders in terms of comorbid diagnoses with other psychiatric disorders and social, emotional, or behavior disorders. And again, I think about for myself, if I didn't understand what people were saying to me all day, every day, if I didn't have a good way of sharing my thoughts and ideas with other people, if I couldn't understand their perspective because I didn't know what they were saying to me, if I couldn't give them my perspective because I didn't have the words or the grammatical skills to be able to do that, how frustrating would life be, and how might I show that in other ways? And I think when you start thinking about language in that way, then behavior as communication makes a lot of sense. So last slide for me, and then I'm going to turn it over to Aimee, just in terms of associated conditions. So we talked about language disorders, and then I think important to know also that language problems can exist on their own in, an example such as a developmental language disorder, but it also can co-occur with other conditions. And for these little guys, there's just layers upon layers of difficulty. And so everything that we've talked about gets exaggerated when language doesn't work well. So I am going to stop sharing my screen on that note and let Aimee start sharing hers, and then we can come back to anything afterwards.
Thanks, Joan. I'm just going to try to figure out how to share my screen with you. Can you see it, Joan?
I cannot. I can just see you.
Okay.
I have your slides, Aimee. Do you want me to bring them up?
Yeah, would you mind?
Let's see if I can do that. Oops, hang on. I got to go out and share my slide screen first. Easier said than done, eh? Nope, hang on. There's something about your slides that don't want to come up. Let me. That's me. We'll get there, Aimee. Don't worry.
Okay.
Joan, if you want to try emailing it to me, I can try also. I think we should point out, though, that between the two of you, you have probably 30 years of post-high school education. Oh, there we go. So you figured it out.
There you go.
Fantastic.
Thank you. So I guess you have control, Joan.
There we go.
There you go.
Oh, am I at the end of your
Yeah,
presentation?
you are. Yeah.
Okay, hang on. Don't look, don't look, don't look. There we go. Okay.
There we go. Thank you so much, Dr. Nicholson, for having Joan and I today. To follow up on what Joan started to talk about in terms of language and its implications on our life in general. Specifically, I want to talk about the impact that language, oral language development has on our ability to ultimately learn how to read, and the functional implications that reading has on our life in general. And as Dr. Nicholson alluded to earlier, this particular passion project of mine has been essentially like 20 years in the making, as I was formerly an educator and then pursued speech language pathology as my career. And I'll touch on that a little bit as we go through the this second half of the presentation. So I'll get you to turn the page there, and yes, that we're from CPRI, and oral language, as Joan had discussed earlier, is very much a natural process. So children learn, especially their mother tongue, their first language. They learn how to speak and understand speech by just being immersed in the language. And excuse me. And for many people, we take that very much for granted. And the next slide, Joan. Thanks. And oral language, that foundational oral language, is so key to a child ultimately being able to understand written text. So each aspect of our oral language development makes an essential contribution to the child's evolving understanding of their words and their multiple uses in speech and in written text. Excuse me. As the child begins to hear, discriminate, segment, and manipulate the sounds of their first spoken language, they develop phonemic awareness, learning the words that are made up of sounds. In addition, they learn the meaning of an ever-increasing list of vocabulary words. And next, they're introduced to a grammatical use of those words found in sentences and stories. Ultimately, a child learns the social cultural rules of a language to be used when speaking with adults and peers. And slide 5, please. Yeah. So unlike the oral spoken language that we learn so naturally, evidence-based research indicates that learning to read is not a natural process and that it must be explicitly taught. So an interdisciplinary body of evidence-based research has been accrued over the course of the past 40 years, providing us with insights on the best practices of how to strategically teach the process of reading. And this research collaboratively has been accrued over the 40 years by the following disciplines: developmental psychology, cognitive neuropsychology, speech language pathology, developmental linguists, and educational intervention research. So it's been a collective effort on all of those researchers' part to support us in better understanding how we can teach reading. So why is the reading research that seems to be so voluminous, why is it not making its way into our children's classrooms? Researcher Dr. David Kilpatrick, the author of Essentials of Assessing, Preventing, and Overcoming Reading Difficulties, he surmises the following about why reading research is not making its way into the classroom. So there might be inaccessibility of research journals to the general public. It's just the sheer volume of the research, trying to get your hands on that information and then making sense of it. So there might be limited resources that are available for teachers that summarize that body of work. In addition, there might be inadequate training for our teachers and school psychologists about the science of reading. Excuse me. The efforts by some to dissuade educators from paying attention to the research, that is one item that Dr. Kilpatrick states, but Stanovich and Stanovich back that up by saying it's very powerful corporate publishing companies and mass media that sometimes try to dissuade the teacher from really understanding what the evidence-based research suggests, in part due because they want to make money on other items. And finally, there might be a limited openness to the evidence-based research resulting from the reading wars. So this is a long-standing dispute among some who wanted to believe that merely memorizing the shape of the whole word versus phonics teaching were the combative beliefs about which was a better way to teach reading. Okay. And we all know the importance of reading. Reading success is the foundation for achievement throughout the school years. Children who struggle with reading in grades 1 through 3 are at a serious disadvantage. They really have a hard time keeping up with their peers academically. They are more likely to suffer low self-esteem and be at higher risk for depression. Many children who are struggling or poor readers display behavior problems. And as a teen, they're more likely to drop out without completing high school. One of our Ministry of Education documents in Ontario, the Early Reading Strategy from 2003, I have a quote there below the picture of the children reading saying, "Children with unaddressed reading difficulties have not failed the system. The system has failed them." And this quote is touches my heart, you know, quite a great deal, because having been an educator myself and working with primarily grade 4-5, I saw the children who were struggling with reading, struggling to crack the code of reading, struggling to understand the underpinnings of phonological awareness. And I really felt that the training that I had ill-prepared me to be able to really fully understand what it was, what were those gaps, and how I could adequately, explicitly support the child in turning that around. And so, like those concerns that I had as an educator, the Ontario Human Rights Commission also had very much similar concerns. And in the last year and a half, starting on October 3rd, 2019, the Ontario Human Rights Commission started a public inquiry called The Right to Read. On their website, they indicate reading is a fundamental skill that students must have to navigate their school experience and their later lives. Students with reading disabilities have the right to learn to read. Yet, the Ontario Human Rights Commission is concerned that our Ontario's public education system may be failing to meet the needs of students with reading disabilities. And on October 3rd, 2018, they announced an inquiry into potential human rights issues that are affecting students with reading disabilities in Ontario's public education system. So if you go to their website, you'll see what they've been doing in the past year and a half in terms of reaching out to communities throughout Ontario, getting their input on what their children have experienced in terms of having access to or not access to resource to support their child who is a struggling reader. And they are also being collaborative in terms of reaching out to many school boards throughout the province, and also all the English speaking faculties of ed across Ontario. So it sounds like they may have a final report to provide to the public sometime in the next several months in the spring of 2021. And so there are a number of debunked myths about learning to read. And why it's important to highlight this today is that unfortunately, there are a lot of frontline educators who have been made to believe some of these myths, and they've incorporated those into their reading programs. And they may have been frustrated with the outcome, but weren't necessarily provided the appropriate tools with which to support the children. So the first myth, of course, we've tried to address that earlier, that reading, some people believe that reading is as natural as speaking, and therefore just merely immersing the child in print and literature will teach the child to read. And certainly a child being exposed to literature-rich environments is crucial, but that's not the end point of a child learning how to read. Also, the second myth, teaching young children to look at pictures, skip over words, and guess at words based on the context will develop the strategies necessary for reading comprehension. So that strategy that is widely used among some teachers is called the 3 cueing system model. And what it doesn't address is the explicit teaching of the phonological, phonemic components of sounds in words that associate with the symbols that we know as letters. And thirdly, the myth that there are hundreds of ways to learn how to read, therefore there is no single set of instructional principles that will work for all children. That is also a myth that we will see in the next few slides, why that too has been debunked by the evidence-based research. And you see on the right side of the screen several books and journals that have contributed to the body of literature about this topic. And so in the science of reading, we have an image of what we are calling the reading brain. So we're taking a look at the areas of the brain, particularly the left hemisphere, where certain aspects of oral language also share a role in learning how to read. So Dr. Marianne Wolf, known for her research in cognitive neuroscience and developmental psycholinguistics, and the author of Reader Come Home, states that reading is not hardwired in the brain the way language is. The research of neuroscientist Dr. Stanislas Dehaene indicates that specific areas of the brain originally designed only for learning speech, sounds, and oral language get reappropriated for these similar but new skills required for reading. There are three main areas of the brain devoted to reading, primarily in the left hemisphere of the brain. So if you look at the front area of the brain, we can see the inferior frontal gyrus, or also referred to as the Broca's area, and it's responsible for speech sound production. And then a little further back in the parieto-temporal area, excuse me, this area is responsible for word analysis and sound symbol correspondence. And further back in the occipito-temporal area, this area is responsible for synthesizing all the information related to words and sounds, and thus looking at automaticity of word recognition. So here you see an image from some functional MRIs that were done in cooperation with a lot of the more recent research, science of reading. Researchers in the past 2 decades have been attempting to better understand reading development and reading disorders in children using brain imaging studies, like the one featured in this slide by Simos et al. In 2005. So like the research featured in the slide, another researcher by the name of Dr. Mark Joannis from the Department of Psychology at Western University has also incorporated fMRI studies of at-risk readers. Before and after, they were strategically provided phonological awareness-based approaches to reading remediation. Dr. Joannis stated, "This research looks at how connections among the brain regions change as a result of reading remediation. What we have found so far is that parts of the brain are becoming better connected as a result of children being exposed to and participating in reading remediation programs. The areas of the brain showing an improvement are involved in mapping the auditory aspects of the sounds with articulatory parts of the sounds. This research emphasizes how the brain processes letters and sounds together." So I want you to draw your attention to the fMRI images and note that before the reading intervention, you see much more neural circuitry involvement on the right hemisphere when the child is doing relevant reading activities. And then at the bottom, after the intervention, you notice much more left hemisphere involvement during those relevant word activities, which has been found to be similar to the same type of brain imaging results found in fluent readers. So I am so excited about Dr. Mark Joannis's research and some of his counterparts that have found this information in regards to the brain imaging studies. It truly supports the value in these explicit strategic interventions that are making a difference in children being able to be functionally literate. And if you want to know more about his research, make sure you take a look at the link below. So Dr. Mark Joannis referred to the mapping of auditory aspects of sound. So he was referring to orthographic mapping. And so you see here in this slide that the child is already familiar with the pronunciation of the word cat. So we need to help the student pull apart the letter symbols that are associated with each of those sounds. And these sounds are connected to the correct symbols, the letters. And by examining the order the letters are in and connecting them to the sounds, they are beginning to map the word auditorily in their brain. So with orthographic mapping, the pronunciation of a word or the word part is broken down into phonemes or the sounds, then linked to strings of letters. In other words, the spelling of cat becomes bonded to the pronunciation of cat. And it's important to remember that orthographic mapping is not the same as memorizing the visual shape of the word. That's very important to know the difference. The whole word language camp wanted to support the idea that memorizing the shape of the word was the way that some children learned how to read. But in fact, orthographic mapping is not the same as memorizing the visual shape of the word. Rather, the word's letter sequence can become a familiar sight word only because the student can attach it to already known pronunciation and recognizing the written word, eventually becoming automatic. Ultimately, the goal of education needs to ensure literacy for all. Our children are so worth it, and the science of reading clearly demonstrates that learning to read proficiently requires a code-based, explicit, systematic, and sequential instruction. These research-based tools need to make their way into the classroom, into the hands of our frontline educators. And through professional development and faculty education training, we hope to be able to support them to confidently help our children crack the code of reading once and for all.
Okay. So I think, you know, the two pieces of the presentation, sort of the spoken language piece and the literacy piece, again, they're skills that for so many people develop with little obvious effort. I think kids, you know, they're working hard behind the scenes, but I think it's when things go wrong that because they develop so naturally for most of us, it's really hard for us even to figure out what is that like for the child when they're going wrong, where is it going wrong, and then what am I going to do about that? So, you know, language, which, you know, covers everything we do all day, every day, and yet when problems happen, we don't really have a good system for dissecting it and figuring out where the problems are and what to do about it. And so that's kind of the whole point of today's presentation, is to say there's a lot underneath that you don't see. And it's dissecting it at that smaller level as you go, the form, the content, the use, the orthographic mapping, all of those pieces that go into a really successful and functional communicator.
Well, thank you, Aimee and Joan. That was a fantastic talk and an excellent review and very thought-provoking. Just want to say, with regards to the work of Mark Joannis, that on our webpage, DDP webpage was ddp.uwo.ca. We have many lectures in the past, and I think Mark's is up there presently, and it will be on our YouTube channel eventually as well. So look forward to that. We have lots of time for questions and comments. So if people want to ask their question orally, which is preferred, just raise your hand, or you can use the Q&A or the chat or whatever function you feel so inclined to use. Let me start then, Joan. I mean, you and I have talked about this with language, and I think it would go the same for reading, that, you know, there's lots of information out there for parents, people with ADHD or depression or anxiety disorders or intellectual disabilities. But yet when we look for information to give parents about language disorders or about reading disorders, there's very, very little out there. Why do you think that is? Given that these are huge problems that affect a large number of people and have profound implications, why do you think there's such little information out there?
I think part of the issue is nobody's taken it on yet. So, I think it certainly could or should be done if somebody wanted to, but I think it's so big, it's so broad. If you go back to that slide where I talk about the components of language, and there's the form, the content, the use, the receptive, the expressive, there's just so many places where language can run into difficulties, that I think to write one book about what happens when there's language difficulties, it maybe overgeneralizes the problem.
I think even like flyers or things like that, there really isn't a lot out there in the same way. So Dr. McLean had a question or a comment. Jennifer, if you just unmute yourself, you can go ahead and speak.
Okay, can you hear me now?
Just lovely.
Okay, so thank you both for excellent presentation, especially that issue between what are the language disorders and how far-reaching they are, but that whole issue about transitioning into the risk for reading issues and the evidence that you showed. So very interesting. As Joan knows, I'm a developmental pediatrician, and I'm quite interested in this area. I wanted to ask a little bit about when you're talking about there's a lot of work being done looking at evidence-based for how to teach children or instruct children how to read. There's a lot out there. One of the ones that's cited more recently, and even though I know it's been going on for a long time, is the Empower Reading Program out of Sick Kids. And I wonder, Aimee, if you were able to comment a little bit about that.
Yes, actually, as Dr. Nicholson pointed out about Dr. Mark Joannis's work, he did extensive work with the local school board here in London, Thames Valley District School Board, where a number of schools were trained in using the Empower program. It has about 30 years of evidence-based research. It's a very sequential, very explicit series of lessons that teachers are trained. The learning support teachers were trained, and the children were brought in to her classroom for an extensive amount of time daily for the better part of about 8 months. And he did the functional MRI with the children before the intervention and after the intervention. And I actually was a speech language pathologist at the time when they, at TVSB, when they started that pilot project and that research with Dr. Mark Joannis. And I had children on my caseload where reading was quite a struggle for them at the beginning of the year, and by the end of the year, they had successfully gained awareness of certain patterns in reading that they had not ever really made sense of before, and it was functionally impacting in a positive way in their ability to independently read unfamiliar words and just really empower them, like the name of the program, to be able to participate equally with their peers in the classroom. It is a fabulous program. It's not a cheap program by all means. It's a lot of intensive training, but I think it's the evidence-based research supports it as one of several similar reading remediation programs that work.
Aimee, you and I were talking earlier too about just, I think, Western's connection and the London opportunities that the Thames Valley District School Board and London Catholic District School Board maybe have had. You talked about Mark and sort of his research with the schools. Earlier, we were talking about Dr. Janice War-Leeper, and she had quite a passion for language and literacy as well. And so I think specifically maybe in Southwestern Ontario and the London regions, we've had some real opportunities for language and literacy experiences in schools that maybe they haven't had across the province as well.
And one last question, if I could, thank you, would be what happened to, they used to call it reading recovery. What happened to that?
When I was an educator myself, I know that was a reading remediation program that some school boards bought the rights to. And certainly it was very labor intensive, like the Empower program. I would have to say that in some cases, some of these programs, although the evidence-based research is there to support it. Ultimately, the budgets of each of the school boards may dictate what they're willing to invest in. And so I think that as members of the community worried about the reading levels of our children in Ontario, it's important that we voice our concerns, like with the Ontario Human Rights Commission, that those programs do work, they're evidence-based, and you know, we would like to see these programs supported in throughout Ontario.
So it's unfortunately, I mean, it's become even more difficult since COVID for the children to be able to get those type of programs at school. And so I can see all these little kids that transition to school and in the early grades when going forward in terms of the concepts of reading are really going to be affected as to what's happened even further since COVID issues.
Absolutely. I'm greatly concerned about that.
Mm-hmm. Thanks. Claire, you had a question? You just need to unmute yourself.
Okay, thank you. And I'm sorry I missed the beginning of the talk. So if this was mentioned, I apologize. But the group and Jennifer's quite involved with this group, PONDA, has a learning disability toolkit that has links to a number of the programs that you just mentioned, and also forms and so on, and information for parents to try to navigate the school system. So I did just send the link to you, Rob, by email, and maybe you could share that, because Nikki Jones put that together, and you know, it's really quite comprehensive. So that's one piece I wanted to add. And then the second, I have two questions. So, and it's very timely for a patient I actually saw today. What about the kids who clearly need help with reading, but they're in grade 1 and the school isn't going to do testing until grade 3, and they don't get support till they have testing to diagnose a learning disability, but the reading isn't actually far enough behind at the moment to probably meet criteria for a learning disability. And I find that common. It seems like a couple years of lost ground. And then my second question is for children with problems, identified problems of phonemic awareness. What do we do about those who are enrolled in French immersion? Does it make a difference, especially as it comes to reading?
So in terms of a grade 1 student struggling with aspects of those pre-literacy skills, the phonological awareness, if their school board doesn't have a formal program where in kindergarten or grade 1 they are screening those phonological awareness skills, it would be important for the family to discuss the opportunity that they may have within that school or in that school board to have the phonological awareness tested by either a speech language pathologist or a knowledgeable reading remediation teacher, because once they have that information, then they can more specifically target those areas of phonological awareness that the child is lacking. And then it can be more strategic, and it's not sort of a shot in the dark. And with that information, they'll be able to perhaps access different types of literature that we call decodable texts. So they take some of those patterns and sounds within the English language, and these decodable texts are actually texts that support the practice of those particular sound patterns that the child is struggling with. There's also a lot of school boards are investing in a program called Lexia. I don't know if you're familiar with it. It does have a screener within its electronic version of this reading remediation program. I really like the program. I've looked at the scope and sequence. It does follow the hierarchy of phonological awareness. It is a pretty solid program. My only caution to any teacher or parent using such a program would be that it still requires adult guidance and adult support. It's not a program I would say just plunk the child down in front of and automatically they're going to make sense of it. It does require adult supervision, adult support and guidance outside of the electronic program. And I'm sorry, Dr. Mitchell, your second part of the question about the vitamin.
Yeah, so that's very helpful. I do get the sense, or I think parents get the sense sometimes that even when they've identified the problem, that they're not doing very much because, you know, of X, Y, and Z. So it's good to know that just even identifying that phonologic awareness, because sometimes it is an important piece to transmit to the school, because sometimes those assessments are done by private speech and language pathologists, and I'm not sure that the communication is good. And I think, yeah, like you mentioned, a lot of times, sometimes the answer seems to be to get a Chromebook. But my question is always like, what are they going to do with the Chromebook? So I take your advice that the adult really needs to be there working with it is really, really important. So the second question, though, for those children where there is a problem identified with phonologic awareness and reading, but they happen to be in French immersion, what is your advice there?
Well, like Joan had indicated earlier, in terms of oral language, if a child is struggling in aspects of oral language, including phonological awareness in one language, fill gaps in the second language as well. I think that the learning how to read, cracking that code, it's going to be valuable in both languages. You know, certainly the child is going to be exposed to many more different sounds depending on which language that they're focusing on. It's certainly, we would want to monitor their progress, and they will need explicit teaching in both languages if the expectation is that the child is learning how to read in both languages. Which, as Joan and I were talking about earlier, when I was an educator, and she knows personally a lot of educators, they have such an extensive roster of curriculum that they have to expose all children to. And of course, you've got your children in your class with individual education plans, and you're trying to support those individualized needs for each child. So I think that certainly the parents getting that information about the phonological awareness in either language, and being an advocate on behalf of your child, really reaching out to the teacher, reaching out to the learning support teacher, figuring out what that school board can offer in terms of support so that the child doesn't get behind.
Yeah, and along those lines, what Rhonda Peterson just put in the chat was that I think a lot of people recognize the need, but unfortunately the ability to get assessments done is not easy to formally identify these things, and that there's a real dearth of people who are qualified for that, unfortunately. Before we move on to other questions, I just want to say that in the chat is Jacqueline Ogilvie put a link to a podcast that she does or has done with Nikki Jones Stockreef and Todd Cunningham from the Ontario Institute for Studies in Education. And the link there is there if people are interested in listening to it. I'm sure it's excellent. Also, so if people will receive a link to fill out an evaluation, and can also receive their attendance record or certificate. And what Sarah O'Flanagan will do is also with that send out the link that Claire just sent me. I will forward that to Sarah to ask others. Dr. Goldberg, did you have a question? You just need to unmute yourself, Ben.
Okay, can you hear me now?
Yep.
Okay. First of all, congratulations to both Joan and to Aimee for the presentations. I'm reminded that CPRI had a major language program in the community at one particular time. We were invited by was reminded about it when, Joan, you showed the statistics on which populations have the greatest amount of language disorders. And First Nations were the ones that had the most. Well, CPRI was invited by the Muncie Reserve to do a developmental study. And the interesting thing was that the mothers of the children said, what we would really like is language development. And so for about 2 years, speech pathologists, language pathologists, went on to the Muncie Reserve and worked with the parents. Just as an aside, I noticed that reference was from the Hennon program. And I don't know, Joan, if you remember Judy Ball. Judy Ball was a language pathologist, and she remembers you as a student. The only reason that I mention that is Judy Ball is a good friend. She works very much all over the world with the Hennon program, which is a language stimulation program. And the critical thing is not so much the language pathologist working with the child, but with the mothers, particularly, and the parents, using the everyday events to stimulate that. So I wonder if you might want to speak a little bit about that, or the Hennon program.
So that's neat, Dr. Goldberg. I didn't know that about CPRI's history and the project on the Muncie Reserve. That's very interesting. I do certainly know Judy Ball. I mean, she is a voice of expertise in early language development and facilitating preschool language acquisition. And so anything that Judy Ball has to say, I would listen to attentively. I think, what you've said, though, really speaks to some of the points I tried to say earlier, in that language happens all day, every day. And I think there is a perception that if the speech language pathologist could just pull a child out for half an hour once a week, that they could remediate these difficulties. But I think the reality is that there is no way you could artificially replicate the use of language and sort of all of the skills that are needed for every day, all day, in a half-hour artificial situation. And so if we can teach the caregivers, teach the communication partners how to reinforce and facilitate language all day, every day, in every activity, whether that's getting out of bed, getting dressed, brushing your teeth, making breakfast, cleaning off the table, all of those language-rich environments, then you've got therapy, for the 16 hours a day that a child is up and moving about and learning. And so I think that is really the philosophy of the Hennon program, is how do we teach the parents to be the therapists, because they're the ones that the kids have access to. They're the ones that the kids are motivated to please. And they're the ones who are really invested in their individual kids. And so they're the ones that are going to put the effort in. So the Hennon program is extremely well regarded across the world. And the fact that Judy has traveled across the world to carry out that program, I think really speaks to that. And I would certainly recommend it for anybody who's looking at that preschool level language and early language intervention strategies.
She sends her warmest regards.
Well, you tell her right back at her.
Okay.
Okay.
Jackie, you had a question. Can you unmute yourself? And before you, as you do that, I will just say, I'll give you a plug. So our next round's on March the 10th, and Dr. Ogilvie will be talking about school supports and educational assistance and the fit with children with developmental disabilities and their benefits and possible drawbacks. So I think it'll be an excellent talk. Jackie, go ahead.
Thank you. Thank you, Joan and Aimee. That was a great overview of the topic and some nice review of the evidence as well. So my question is around the, I was going to see if I can't turn my camera. my question was around the Lexia program, because we certainly have seen that school boards are gravitating to that because it can be still used within COVID. But having watched my own child have access to it, I wonder about the trial and error success with it. And maybe you know a little bit more about the algorithm that's used and the evidence around how it actually works and walks the kids through it. But I noticed when I wasn't sitting with her at the beginning, it really was just kind of, can I drag this and causing just trial and error. And once I get it right, then I can move on and then I'll try again. Does it take that into account, and does it build the child or progress them through so that it's, I guess, taking that into account, the program?
Yes, that's something that I would like to look further into, Jacqueline. I know that the theory behind the program is definitely built on a solid understanding of the hierarchy of phonological awareness. So in order to get to the next level, the expectation is that they're mastering the first level that they're on. And but I hear what you're saying. You're concerned that, are they getting enough repetitions, successful repetitions, before moving on to the next level? And certainly that's why I caution anyone exclusively using electronic programs like that. I think that it's still very valuable for speech language pathologists, teachers, parents, to be able to play games with their child to boost those gaps, to be able to give them lots of different opportunities in short bursts, but in lots of different opportunities to be exposed to those sound patterns that they're struggling with.
I agree. Yeah.
So before you go, Jackie, and I think this would be for you and the other pediatricians with us, that so Dr. Pryor had a question. I see children who appear to have oral motor insufficiencies, which contributes to difficulties with speech production and output. But I think her question is, how do we assess if there are other physical contributors to these problems or other medical problems that may contribute, that typically these kids aren't examined closely for neurological or other medical issues? And what would pediatricians suggest should be done?
You want to drop that to me to start?
Sure, you are live, so why not?
I'm muted. I guess you could refer to your friendly pediatrician with that question, or developmental specialist. But I think that is something we look at in our practice as developmental pediatricians in collaboration with the speech pathologist. And I think to break Dr. Pryor's question down, oral motor insufficiency, if she's wondering about like palate insufficiency, that's something we can try to visualize and refer on if we think there's need to take a closer look to someone like our ENT, especially if there's a child with a craniofacial abnormality or something that would put them at risk for that, or they had other midline abnormalities. So a child with a congenital heart defect might be something that certainly would be something that we would look for when we're examining them. So those would be things that would come to mind, and I think a pediatrician would also think to look for those as well. So it would certainly fall within the pediatrician's scope, especially if concerns around speech and language have been raised, just as things like making sure the input is working properly. We want to look to make sure the output and the oral mechanism is working properly.
Thanks, Jackie. Claire, did you want to add anything to that?
No, I think Jackie articulated it very well. Input from hearing to output from anatomy, and then of course, looking at things like dysarthria, apraxia, and so on in between. So I think a pediatrician can give that a good start, and then direct it wherever they think is most appropriate. So sometimes the apraxias will come to us, but a cleft palate, that goes to ENT at least to start with.
Thanks. And also, Kirsten Blaine had a question. Nice to see you, by the way, Kirsten. So she was recently told by a family about something called the Wilson reading system. Aimee, I don't know if you're familiar with it. It's called the Wilson reading system.
No, I'm not familiar with that one.
Joan, have you ever heard of it?
Not.
And so what Kirsten was saying was that, she couldn't find anything about it, and that apparently it's quite expensive. And one of the concerns she had was that people running it had suggested that a child stop taking medication for ADHD, which seems a bit difficult to understand how that's going to help somebody learn to read better.
Yeah.
But neither of you has heard anything about it. Has anybody in the audience or any attendees ever heard of the Wilson reading system? So I guess,
that in itself sort of speaks volumes, doesn't it?
yeah, I was just saying that the fact that nobody's heard of it, Kirsten, I think suggests something about the, no, I don't want to say legitimacy. I don't want to be accused of slander or libel or whatever that is, but about the knowledge base that people have of it.
And Dr. Nicholson, to that point, I found that a lot of school boards will nab on to some of these electronic programs that the publishing companies are like really pushing, really selling. And there's been a few that schools have indicated to me that they're using with the child. And I've looked into a few of them who claim to be evidence-based, but they're very loosely using a phonological awareness hierarchy. And I have great concerns about how some of these companies are so very market savvy in terms of, getting schools and school boards to invest in their product. And unfortunately, the people making those decisions aren't fully aware of what criteria would make a really good program. And actually at the end of my last slide, there's a link that I've included that has the Reading League is a organization that supports teachers in learning some of this science of reading. And this is a curriculum evaluation tool to determine if the program that you're using is adequately using the science of reading in the reading program.
So, Aimee, in the chat, I guess there's several questions about programs that you would recommend and things like that. Is it fair to suggest that people can just email you to ask that question? Do you want to say your email address so that way I don't get accused of problematic behavior by anyone?
Okay, so my my CPRI email is my first name, Aimee, AIMEE, dot field, FIELD @ontario.ca.
So along those lines, are there any particular programs that you would strongly recommend?
Excuse me. Certainly Dr. Mark Joannis, in his research, you'll see in the link that I put about his research, he specifically names 3, Empower being one of them. There are 2 other programs that have been evidence-based, and these are programs that are usually adopted school-wide or school board-wide. Then there's those electronic programs that are a little more financially feasible for some schools and school boards, like the Lexia program. But again, a lot of cautioning around that still needs an adult to support the child in making sense of what's happening on the screen. There is a great tool that has been developed out of, I'm trying to remember, one of the universities in Florida, and they have a plethora of hands-on, low-tech activities that specifically target some of the areas of phonological awareness that the children might be struggling with. So once the family or the teacher knows what areas the child's struggling with, those low-tech game-like activities that are accessible through this particular university in the United States, they're fabulous. I've used them in treatment with some of my students when I worked for the school board.
I've heard some parents talk about the Scottish Rite program. Do you know much about that?
I'm not familiar with it. No, Scottish Rite?
Yeah, it's Rite is RITE. I know they have a program here in London.
I'll have to look into that one.
Yeah, I've heard parents mention. I really can't comment on the quality. So if you have any thoughts, that'd be helpful.
And Dr. Nicholson, if I can find that link to the the low-tech activities, will you be able to share that with the group?
Yep. I mean, I don't want to volunteer Sarah to do things, but I'll say yes.
Okay, thank you.
Just excellent. Are there any other questions or comments that people have before we wrap up? All right. So thank you both, Joan and Aimee. This was an excellent presentation and really helpful. And I think the fact that it is now 5:23 suggests that there were lots of thought-provoking information that you provided. So everybody will, I think, will receive a link to an evaluation, which is helpful to us. And also along those lines, people will also be able to get their attendance form, and we'll make sure that the link that Claire has goes out as well. Although Claire, is that the link you just put in the chat now?
Yes.
Excellent.
Can you hear
So
me?
then
Yes.
we will not be sending it out to anybody because it is there for people who want it. So just a reminder that next month our presentation will be by Dr. Ogilvy talking about educational interventions and the goodness of fit. And Ms. Gardiner just asked me to say that she continues to find language and language disorders fascinating. And although today's presentation is only a snapshot into the topic, she will be happy to have people contact her personally at home at any hour of the day or night, and her family would also really welcome that very much.
They love it when we talk about language. Yeah.
Excellent. That's fantastic. So that seems like an open invitation. So everybody, thank you everybody for coming, and we will see everybody next month. Thank you again, Joan and Aimee. That was excellent.
Right.
Yep.
Thank you.